Hot flashes, a lack of sleep, a lack of concentration, vaginal
Brain
dryness. These are probably the most typical symptoms that someone is going to feel when they're hitting the perimenopause.
So just everything we all go through anyways.
Sorry, these chairs, I just haven't done this in a while. Come on in.
Coming in.
Get
coming
comfortable.
in. Yes. What a surprise. Thank you.
The tables have turned. Get cozy. Did you want to put your legs up?
I'm okay.
Are you comfortable like
Thank
that?
you.
I guess I feel right like this. I know you got to like tuck all the right parts in.
Well, it's okay if it bulges right, but
The bulge, my bulge
Yeah.
is like, it looks like I have a tiny or a big. Well, thank you for being here.
yeah, it's my pleasure. I'm just didn't even know what I'm getting myself into.
I know. I love that you just blindly said yes to this. We're very excited to have you. Welcome to the Stir Up, a podcast brought to you by O Positiv. It's going to be a podcast where we stir up everything about women's health. I'm here. I'm very excited to have you here. I am here with double board certified OBGYN, reproductive and endocrinology and infertility specialist. I added some ands in there, but guys, get excited. Shahin Ghadir is here, everybody. Come on, let me hear it.
Thank you. I've never had a welcome like this. Honestly, I have not.
The chair also moves if you want to go up and down. This feels comfortable to me. I just feel like I need a camera on all angles.
And it has a spot in case you have to give a urine sample for a
Oh, is that what-
urogynecology examination.
Oh, I just have this for people to pop up with a fan. And then my snacks come through here too.
Great.
Yeah, if you need water, somebody will pop through
Thank
yours too. So like, let's get started from the beginning. How did you get into endocrinology? Like what made you excited about the subject?
So I was in med school,
Okay.
and I realized that I had a dislike to be around very sick people. So I decided, after doing some soul searching, that obstetrics and gynecology is for me, and I absolutely loved it. I was doing a residency at Kaiser Permanente in Los
Yeah.
Angeles and having the best time ever. And I happened to do a rotation in reproductive endocrinology
Yeah.
and infertility, and I realized this is the thing for me. It was one of the most advancing, evolving sciences in all of medicine. I was able to be around healthier people, which made me happy, but at
Yeah.
the same time, help people with one of the biggest issues in their lives and one of the most rewarding things that I could be doing in my entire life. So
Yeah.
altogether, it became something that was a perfect fit for my personality, a perfect mix of science and medicine, and allow me to change people's lives.
I love that. That's such a beautiful answer that I want to make fun of, you know what I mean? But that's just my tendency. That's so
okay.
funny that you didn't want to be
I
around sick
can
people,
take
but
it.
you were like, I'm going to be in women's parts. What do you feel is the number one question that you get from women with infertility right now?
I think the number one thing that I hear all the time is, why is infertility growing so much? Like, why is it that, like, our mom's generation didn't have infertility? And to me, it's very simple, and I see this all the time. Our parents and our moms were having kids in their early, mid-20s. And no longer does anyone in their early 20s or mid-20s even think about fertility.
Yeah, we can vote now.
Yeah, exactly.
Yeah.
So it's something that is completely put aside until someone is usually in their 30s now. And we know from the science of fertility that after the age of 26, 27, 28, there's a significant decline in women's fertility. Some people begins before that. That's the average age of the decline of female fertility is in the late 20s. So we have patients that come in their early 30s and already have a major decline in fertility. And then we have patients that also in their late 30s are still doing amazing and have had no decline. But the average age of decline is 26, 27, 28.
Oh my God, I don't even remember those years. Like, where was I? What was I doing? Why do they call it geriatric pregnancy? It's such a, can't we change the name?
I don't know whoever made that name. I think it's really an awful name because that's for people over the age of 35.
Right.
And now that I'm way past 35,
Yeah.
you're really young at 35, and no one should be saying geriatric anything to you.
Right, yeah. So let's take it back. What is the endocrine system? Explain it to women.
So the
who don't know.
endocrine system is the study of all of our hormones. We have thousands and thousands of hormones that make this body tick and make this body work well. And it's a very complicated science, to be honest, endocrinology. I think some of the smartest people I know that go into medicine go into endocrinology.
Right.
And of course, reproductive endocrinology just the cream of the
Look
crop.
at his eyes.
But
Do you see his eyes brightening up when he talks about it?
generally speaking, though, it is a complicated science, and there are many more hormones that regular endocrinologists are involved with than a reproductive endocrinologist like myself that involves only the ones that have to do with fertility.
Right.
It's a complicated area because the right amounts are very different for every
Right.
single human being.
I'm going through hormone therapy, as we discussed like a little bit before, and there's so many answers and questions, and like they're all different. Everybody has a different opinion, and the way you're raised has different, but do you feel like there's stuff in our environment more and more, like the foods we eat, the toys we play with, the plastics around us, that are contributing to infertility in women?
I think that all of the things you said right now, plus many, many more, are contributing to many aspects of our health and our life.
Right.
So
We're
I
dying.
think that all the environmental. So number one is age, and we've gotten that clear. There's nothing more important right now for fertility and the causes of infertility that are age related, and then it's the environment.
Right.
So all the things that we do in our environment now, there's like the preservatives, everything in our deodorants and our sprays and our chemicals and our manicures and everything that we do. Again, our parents' generation didn't have those things.
And they were like smoking cigarettes inside.
Well,
like doctors.
that definitely was not good for them, and I think they realized that.
Right.
But at the same time, this evolution to this world that we're in now, if you wait from the second you wake up in the morning, the products you're using, to the time you go to bed at night, the products you're using, we don't know how these affect every single person.
Right.
They could affect you in one way and affect me in a completely different way. So this is complicated. That's why I really believe in being as clean as possible in terms of like affecting yourself with the least amount of chemicals, eating as clean. I'm always talking about, for example, and we may talk about this later, about like your diet.
Right.
You're
eating McDonald's every day going like, why can't I get pregnant?
Exactly. I have a reason why you're not getting pregnant.
Yeah.
We just came back from being in Greece this summer, and I can tell you they have it down. So the Mediterranean diet and what the foods that are there and everyone's eating in Greece and in the Mediterranean are the way to live.
I keep hearing this about like the Greek diet, just like in.
It's just the Greek, and it's not only the Greek, but it's truly like, the Italians, all the people in the Mediterranean that really know how to eat healthy and eat well, they're not exploding from eating too much pasta. They're actually incredibly healthy.
Well, that's also the food, right? In America, there's so much more, like the way the flour is cut, all that stuff. So it's just like eating clean is almost more difficult. So the plan is just move out of America if you want to have a baby.
If you want to be healthy, you got to move out of America.
You got to go to Greece immediately, swim over there, whatever you have to do. So obviously nutrition is the number one thing. And how do you find like what nutrition is good for your body? Like what's a good way to do that?
I think that being organic, or at least doing your effort to not buy things with expiration dates on them and trying to eat whatever is healthy and green and fresh and putting it together yourself, which is hard.
Right. It's expensive and hard.
And hard. But thank God stores like Costco, like half of the produce department has, a green sign that it's now organic. So you can do that. You can try to get away with it. And it's getting better and better and better. But I think one of the first things to do is try to keep yourself away from the pesticides, the hormones, all of the additives that are on to all the foods. So trying to do things in the healthiest way possible is really good.
It's so difficult to do that, And then meanwhile, we're like doing Botox, and then we're like getting our nails done, and there's perfumes and makeup. Like as far as those kind of products, like are there any like stay away from these as far as fertility goes?
In terms of fertility, no, because it's very hard to do studies. We know that aluminum has a link to like dementia and Alzheimer's. That's why you stay away from aluminum.
So don't eat aluminum.
Don't eat your deodorant. Okay, that's one thing.
Okay.
But in general, for fertility, it's really hard.
Right.
It's very hard to assess, like, what was the preservative in that cereal that is not good for my fertility. There haven't been studies done on every single chemical in food. But I think when you're trying to stay away in general from things like that have, preservatives in them, or they have ingredients that you have no idea what they are.
Know the ingredients. That's I don't look at anything.
You look at the
ever.
ingredients. If you're in an aisle where you have to look at the ingredients again and again and again and look at expiration dates, you're in the wrong aisle.
Good to know.
In the fruits and vegetables department, there are no expiration dates and there's no preservatives and ingredients.
Like, I had a cucumber that was like literally bent. I was like, this
that was not a good cucumber.
Yeah, not a good one. Okay, so if you're looking into fertility and you're like, let's say in your mid 30s, like where does the journey begin?
So I have some numbers that I've kind of arbitrarily over the years made up in my head.
Okay.
Okay. The American Society of Reproductive Medicine gives you an official diagnosis of infertility. If you're under the age of 35 and have been trying for 1 year, then you're diagnosed with infertility.
Wow.
If you are over the age of 35 and been trying for 6 months, then you get the diagnosis of infertility. So those are the American Society of Reproductive Medicine.
Wide range.
Right. So,
Yeah.
but I'm not going to be waiting till a 39-year-old is trying for 6 months to help them. That's not how I do it. I tell everyone the younger you do everything in the world of fertility, the better it's going to be. So if you want to have your prime eggs frozen that are going to
Right.
give you the best outcome, you better do it in your early 20s or mid 20s.
Wow, that early on.
But the number
if you got
of
the money
patients,
and you don't have
so
student
it's
loans,
complicated
which,
because those are patients that are just finishing college.
Right.
It's a population that has very little extra
Equity.
equity and extra cash laying around.
Yeah.
So with all of that being said, it's very complicated. So I have made this number in my head that if you hit 30, you need to freeze your eggs.
Okay.
Even if you have a partner and you're 30, just because there is a partner standing next to you does not mean your fertility is now being preserved.
Right.
So it's incredibly important. Let's say you want to have 3 or 4 kids.
Okay.
And you're 30.
Don't do it. That's my
Well,
advice.
Bad advice.
Too
do
many
it.
kids.
But
Okay.
You got to think ahead because
yeah.
baby number 3 may be coming when you're 38 years old. Baby
Okay.
number 4 may happen when you're 41 years old. Already, if
Right.
you haven't done something to think in advance, you're going to give yourself a really hard time of success.
Right. And I feel like a lot of women are like, I want to have a partner before I do this, or I want to, but you say, go ahead, freeze those eggs, put them in a little house somewhere.
I have, if I had $1 for every time a woman came to see me and said, I was in a relationship and I thought it's going to go this and I thought it's going to happen. And the next thing I know, 5 years later, nothing happened. And she's like, that's why I didn't freeze my eggs. I thought I was going to have a kid with this guy.
Right.
And it didn't happen. So
Yeah.
I have lots of smart girls that come in and they're like, yeah, I have a boyfriend and something may happen, but I'm freezing my eggs right now.
Smart girls. Okay. Interesting. Yeah, I think a lot of women, don't even get to the subject of wanting to be pregnant until later. So if you are in a later stage of your life and you haven't frozen your eggs, like what are some things to start kind of thinking about in that kind of situation?
So I think I have a motto, it's better to have one frozen egg than no frozen eggs.
Right.
I have had patients of mine that are pretty open about it. They were, in entertainment and talked about it
Yeah.
all over that. They
So
came
broke?
No, but they came in at the age of like 44 and froze their
Right.
eggs. I don't think I've ever had or heard of anyone who had an egg being frozen
Yeah.
over the age of 45 that worked.
Oh, wow.
Yeah. So
That's a scary number.
but the number of people also that this is working for
Yeah.
at the age of 44 or 45 is very limited. Like they're the lotto winners in the world of fertility.
Right.
So but the patients that are getting successfully pregnant at that time, there are many, many women in their late 30s, early 40s have tremendous amount of difficulties.
And obviously the price ranges, but like what's the average price just so women can kind of have a place to know? Because I've always heard like 10 grand.
So to freeze your eggs is around 10 grand. We were having a great
Okay.
special in my clinic for the last 8 months. It just ended. It was
Freeze your eggs now,
Yeah, I know.
ladies.
I wish it was 7,500, but it
Right.
included all the medications as well.
Wow. So you inject yourself with hormones. So
Yes.
take me through the process a little bit.
Sure. So
Yeah.
if anyone is interested in freezing their eggs, they would reach out. They would set up a consultation, whether it's
Okay.
in person or we do them virtually. So we learned a few things during
Yeah.
the pandemic that you can
Yeah.
do a consultation and you don't have to drive 1 hour to see your doctor, park,
Right.
go back to work. So you can do it virtually. We can do it by Zoom. We can do it by the phone. We can do it in person.
Okay.
So you set up a consultation where I go through everything about your health, about your goals, about your partners, no lack of partners, everything. So whether it's for egg freezing or IVF to try to get pregnant,
Right.
we always start with a consultation. Obviously, if it's to get pregnant and you have a partner, whether it's 2 men, 2 women, or a heterosexual couple,
Yeah.
it's nice if everyone shows up.
Right.
To see what everyone's involvement is going to be. So we get a good, thorough history, physical, we get everything that we need to do, and then we put diagnostic blood tests out there. So there's some blood tests that are really, really important to tell us how
Okay.
people are going to do. And there's one in particular called AMH. And the AMH,
Okay.
anti-Mullerian hormone,
Ooh,
comes,
say that
yeah,
say that a bunch.
anti-Mullerian hormone, AMH.
Anti-malarian hormone.
Yes, it comes from your eggs.
Okay.
So when you do a blood test and your AMH level is high, you've got a lot of eggs. If your
Nice.
AMH level is low, you have low level of eggs. If your AMH level is extremely high, you may have polycystic ovary syndrome because those patients have a lot of little follicles.
Okay,
So-
wait, let me pause you really
Sure.
quick. So you're born with all your eggs.
So
yes.
when in utero, when
Okay.
you're in your mom's uterus,
Just chilling, yeah.
right around halfway mark, you have your maximum number of eggs, which is about 20 million eggs inside your ovaries.
Wow, so even when you're inside your
Yes.
mom's belly.
Yes.
So you okay.
By the time you're born, that number has gone from 20 million down to 2 million.
Where have all the eggs gone?
They disappear.
They disappear.
They kind of die off.
They die off.
Yes,
Okay.
they die off. By the time you're born and by the time you get your first period around the average age of 12 or 13,
Yeah, 14 for me. I was a late bloomer.
your egg reserve is down to about 435,000 is what textbooks like
Wow.
to say.
Okay.
Yes. And then every single month, once you've gotten your period, where you get an ovulation,
Right, and you shed.
and one egg is ovulated, about 1,000 eggs die off in that process.
Wow.
And that is why women's egg reserves kind of run out and they go into menopause around their age of 50, 51 years old.
Right. Is there something that decreases your egg levels besides just menstruating? Like, are there lifestyle choices, or things that you can
Sadly,
expose
there are.
yourself to? Yeah.
Yes, there are. So everyone in the world of fertility knows, for example, like smoking deteriorates and ruins your eggs really fast. And
Weed or tobacco?
Well, tobacco for sure.
Tobacco for sure,
Weed
yeah.
also, there's been a lot of research out there. But the days that they did a lot of research on weed was when you like rolled a joint and you smoked it.
Yeah, that's
Not
kinda
when you
what I
go
do.
now to a store
Yeah.
where it's like a shopping mall of all the weed
Right.
options
Like
that
the
you
candy,
have
yeah.
and all the different things. So they have not done a study on the 50
THC
million
levels
things. Yes,
versus
exactly.
smoking. Okay.
There's not a lot of studies on this and that and all of these things. So
Yeah.
I give a blanket
Don't smoke.
It's just about
Yeah.
weed has been shown to make sperm poor quality, eggs poor quality,
sperm is stoned.
and increasing your chances of having an abnormal embryo too and a miscarriage. So just absolutely no.
Right.
But like also like excessive drinking,
Right.
when it starts to affect your liver, then it starts to affect everything, and it's not a great idea.
Right.
Because all of the sex hormones come from the liver. And are replenished from the liver.
It's so funny because they say like, don't drink, don't smoke. But then you see all these people that are like drunk smoking, having babies.
Yeah,
I'm like, how do they do it?
Yeah, so listen, I tell people you want to have a drink, have a drink.
Right.
You want to have one or two drinks here and there a couple times a week, you're okay.
Yeah.
But if you're actively trying, you should be probably better than binge drinking for a weekend.
Right. Just don't drink when you're trying to.
Right. There's also sadly a lot of chemicals and things like chemotherapies and radiation that destroy egg
Right.
reserves, sperm reserves, and all of those things. So those we have really not that much control over. If that ever is an issue, we get those patients in incredibly fast, freeze eggs, freeze sperm right away in our clinic. So after you've done your consultation, the most important aspect next is the diagnostic testing. So the diagnostic testing involves an STD panel that is mandatory by the FDA. Yes.
Why is that?
Well, in order to freeze your eggs and put them in a lab,
Yeah.
they need to know the status of your HIV, hepatitis B, hepatitis C, and syphilis. And for men,
Whoa.
it's an additional called HTLV. Now, if any of them are positive, it does not
Yeah.
mean you cannot freeze your eggs or have a
Right.
kid, but then it has to go into certain sections of our lab.
Oh my God, they isolate the little.
There's certain departments
The
or
STD
divisions
eggs.
that have to, yes.
Interesting.
Yeah.
Could the eggs possibly get the other eggs?
Not really,
Give the
because
other
all
eggs
of
an
everything
STD?
is, no.
Well, I
not
don't know,
really,
but-
but the FDA wants to be extra careful.
Interesting. Okay, cool. So you do this test, the panel.
So we do testing on the STDs. We do
Yeah.
the diagnostic blood test called AMH, and then we give some and then the men, for example, will do a sperm analysis, but for women, it's the hormones. And then there's another panel of hormones that are done on day 3 of the menstrual cycle. So once you get your cycle, you call in, and then usually come in on day 2, 3, or 4. We call them the
Okay.
day 3 labs.
Okay.
And then those give us additional information about your hormone levels and how you're doing.
And is that the 3T test they always talk about, or is it a completely different panel? Or am I just making that up?
I don't know what a 3T panel is, but
See,
we could
making
go with
it
it
up.
if you want us to.
You're like, you're making that up. So when they test for all the different hormones, what is that panel called?
So the day 3 labs in the
Yeah.
world of infertility
Yeah.
are FSH, LH, estradiol.
Oh, so
We
they're
generally
different. Okay.
put some things on called TSH for the thyroid. We add a prolactin, things like that. And the AMH can be done on any day of the month. So that hormone that has to do with your egg reserve can be done on any day of the month. It does not matter. It doesn't matter even if you're on birth control pills.
And what is the one that we're looking for on day 3 of the panel?
FSH, LH, and estradiol.
This is crazy. What did you do to study all this in college? A lot of coffee? Like, how does it stick?
I don't know. It just does.
It's a lot of, I don't know. It's a
Because
lot
I
of
really
acronyms.
enjoy it.
Yeah, that's cool. And so we're looking for their levels to be high. We're looking for their levels to be low.
So some of the blood tests, like
Yeah.
your AMH, comes from the egg. So the higher it is, the better it is.
Okay.
But your FSH, the higher it is, the worse it is. So the FSH, it's better to be kind of on the lower end.
Okay.
Because when your FSH is higher, that means your brain is trying really, really hard to release this hormone, to release your egg that month. And the older you are, you have to release more of it. So this hormone goes up, and that's a sign of aging. So your FSH, we want kind of a low. You just sprinkle a little bit and poof, you ovulate. So
And
it's a
it's-
young, healthy woman.
Oh, okay. So that kind of goes along with estrogen. I've been reading a lot about like how there's so many receptors in your brain that estrogen has to do with, and when that's low, that your brain kind of gets like, oh, that's why we have so much brain fog.
So this is very interesting. Estrogen can have to do with brain fog.
Yeah.
You're absolutely correct. But at different times of the month for a woman and in different days, the estrogen should be different. So if your doctor tells you you're really low in estrogen, but it's the beginning of the month, well, guess what? It's supposed to be really low in the beginning of the
I'm
month.
getting nervous here because that's not what my doctor told me.
But
okay.
your estrogen, it's the fuel for ovulation.
Right.
So during those 14 days that generally takes to get to ovulation, it needs to go up. So it's generally around 300 when ovulation occurs. So it just depends where you are in your month, what the levels of the hormones are. Just like I was telling you earlier, progesterone levels start off really low. Once you've ovulated that capsule of the egg, that capsule releases progesterone and tries to maintain a pregnancy.
Wow. This is a little veering, but do you find that women who have had children, their hormone levels are more sustained later in life versus women who have not had babies?
I'm not sure if you can make a correlation about that.
Okay, interesting. Okay.
Because there are people that have had kids and then come back to me because they can't have kid number 2 or 3.
Right.
And then there's people that never tried and then had difficulties or didn't have difficulties. So I don't think it really does.
It's hard
one
because
way or
we're such
another.
snowflakes. You know what I mean? We're all so different. There's
We
not
are.
like
Everyone's so different. And that's what I love about what I do, because every
Yeah.
single woman or every single couple that has come to see me is completely different.
It's a puzzle.
Yes.
Also, when you dated, did you lead with, and I'm an OBGYN? Or did that come out later?
That
or-
didn't need to be said.
Okay, good. Because, and also when, are you married?
Yes.
When she's on her period, are you like, does she come to you? Does she ever come to you for stuff? Because I feel like I'd be asking stuff every day.
She asks a lot of questions, but she knows that I'm done when I get home. So call your doctor.
Sorry,
is a really
honey,
good
call your
question.
doctor.
Yes. Call your own
I love
doctor.
it, yeah.
Of course, her doctor is my friend, so I feel bad for that too.
Hey, Mike. Interesting. Okay, so you have this blood work that you get done on day 3.
Yes.
FSH,
LH, estradiol.
That's the
and
one
if
that you want?
everything
Well,
looks
yeah.
good and we're doing egg freezing, most women at that time would transition into starting injections. So the injections go into their belly. They are injections that are not hormones. They are precursors of hormones.
Okay.
They trigger the pituitary gland in your brain. The pituitary sends a signal to the ovary, and then the ovary starts to make its own hormone, estrogen, which is the fuel for creating eggs. So we're
Right.
giving this to you in higher doses than what your brain does normally. So instead of making one egg that month, the egg that you ovulate,
Right.
that month, hopefully, if you're young
on
and you're
overdrive.
healthy,
Yeah.
you just give a little medicine and then 20 eggs are made.
And what are the symptoms of it besides just like, are you like, is there like a manic state that you go into, or are you?
No, you don't go into a
Yeah,
manic stage.
yeah.
I think people are generally do really, really well.
Yeah.
But you start to feel bloated. So your ovaries are usually like 2 little walnuts sitting on both sides of your uterus.
Yeah.
With these injections, they start to grow. All these little eggs start to grow.
Right.
And they start from these little tiny bubbles that are on your ovary. And then each mature egg comes out of a bubble called a follicle, and that follicle becomes about 20 millimeters, which is 2 centimeters. So that big.
So of course, so you get a little belly from it.
Well,
a little
once
bloating.
you have
Yeah.
both of these growing like 10, 15 on them each, you're going to have, by the end of those 12, 14 days, about 2 big grapefruits tucked into your body.
See, we
So
can't have it all. We can't be tight and have. You can't have it all, women. I'm sorry.
You can't have it all. You're going to feel bloated.
Yeah.
I get very happy when someone's like, oh, I'm feeling bloated. I'm like, you're doing great.
And the shots themselves, I had to give my friend a shot once. It's very thick, the liquid, right? It's almost like a
No.
No.
So there's different kinds of shots.
She's like, no, you're a liar.
You're a liar, and that is
you're a liar.
absolutely
That's
wrong.
it.
And
Can
it
we
is
get
not
this?
a thick, painful injection. Do not listen to Jade. She doesn't know what she's talking about.
It was hard to give. It was hard to give the injection, but maybe it was the second
Should we
round.
go back to repeating the title again?
No. Hey.
It is not a thick injection.
Okay.
So the injection.
Did it used to be?
There's an injection
Yeah.
after the embryo goes in you.
Okay.
It's called progesterone and oil. That goes in your butt, and that's thick. And I'm
That's
sorry, ladies.
yeah.
It's part of the whole process, but by then you're pregnant and you're willing to do that. That one is painful and bad, and the needle is a little bit bigger.
Okay, that's
but
the
it's
one that
only
I gave.
one a
'Cause
day.
It took me a second to get it in. I was like, whoa,
Yes,
it's harder. Yeah.
But all the injections, the ones that go into your belly
Yeah.
that are helping you create eggs, are incredibly small needles.
Okay.
I used to say they're
Yeah.
just like the needle for like an insulin pen, but now it's like the Ozempic needle. Everyone knows that one
That's
a lot
the one
better.
that I get some.
So,
It's like your ears pierced.
it's a very, very, very tiny
Yeah.
needle. Some of them are in the form of a pen. You just put it against you and you push it and it goes boom, right
And
in
how
you.
many times a day are you doing that, or how like?
It's one time a day.
Okay.
There's one injection that's morning and night, but most of them are one time and it's like 3 injections.
And okay, so 3 days. So that's not. That,
No. It's 3. You give one, you take the next one
Oh,
and
I
give it,
see.
and the next
Literally.
one.
Okay.
It's for about 12 days.
12 days. And now we're in this process of creating
And
the
during
fuel
those
for
12
estrogen.
days that
Yeah.
you're giving yourself, we bring you in for monitoring. We want to make sure you're not making too many, too little. We bring you in, we do ultrasounds, we look at your ovaries, we check your estrogen levels to make sure they're not going sky high. We try to monitor you. If your estrogen levels are going too high, we'll bring your medication dose down. If they're not really going anywhere, we may take your medication dose up. But we keep a close eye on you, and sometime towards the end of the 10 to 12 days of injections, we're going to tell you, Jade, you are ready to freeze your eggs and to have your
Wow.
egg retrieval. And that's the process that is in our surgery center. Our anesthesia team gives a little bit of an IV into one of the veins, and then they inject a little bit of medicine, sedation, like a propofol. It's a kind of
Ooh,
puts
fun.
you
Yeah.
fun stuff.
Yeah,
You have the best. I
You
tell my
nap so
patients, you can have a
hard.
really good nap
You
right
nap-
now.
you do
Think
nap-
about something
yeah.
really good.
Yeah.
It's usually about 5 minutes to 15 minutes, depending on the number of eggs. And as this egg is coming through, it's going into a little tube and
Yeah.
collected in a test tube and being passed on to our embryology team, and then they're counting the eggs. So by the
And-
end of the procedure, we know how many eggs they had.
Wow. Okay. So just to back up a little bit, you said that they come in like just to check the levels of estrogen, and then the ultrasound. During the ultrasound, what are you looking for that you might not want to see during that process?
So let's talk about what we want to see.
Right.
During the ultrasounds, we want to see little bubbles all over the ovaries popping up. And every subsequent visit, I want to see those little bubbles getting bigger and bigger and bigger.
Okay.
So once I see a bunch are getting around that 20 point, I know it's ready to get these eggs out.
20. Okay.
Yeah,
Wow.
about that 20 millimeter
Okay.
size. So then those eggs are getting ready to come out.
That's crazy.
And that's when we schedule them for what's called the egg retrieval process
Right.
in the surgery center under anesthesia.
And what do we want to see? How many eggs do we want to see about at that point? What's the average that you're like you'd feel really happy about?
Well, it depends. So
Yeah.
I tell everyone, I mean, it really depends. Do you want to have one kid? I mean, are you 45 or are you 27? So these are the things that really depend
Let's
a
say
lot.
we're a mid.
So let's say you're 33 years old
There
and you
go.
come in and you want to have
Jesus
two
age.
and you want to have 2 kids.
Okay.
So there are studies that have said that women that are 35 to 39 needed to have between 20 to 26 eggs to get a live birth.
Okay.
Now, I think that's a huge generalization. It was a study, but it included clinics all over, and not all clinics are made the same. So I think if you're in one of the better top-rated clinics, maybe 15, 20 eggs is a good number to
Okay.
reassure that you can have a kid.
Yeah.
I have had patients that had 30 eggs and didn't get a kid. And then I had patients that had 2 eggs and got 2 kids.
Right.
So again, we're not really sure exactly what the quality of your egg will be. The only thing I can tell you at the time of your egg retrieval and by the next day is how many of your eggs were mature and got frozen.
Okay.
That's it. Unfortunately, we can't give any more information than that.
And then as the eggs sit frozen, is that how you can see the quality, or is it only when it's
Only when it makes an embryo. Once we put it with the sperm, okay, that's when we know when it's going to be, that's when we check for fertilization.
Okay.
So we know the sperm and the egg it fertilized, and then we watch them grow. Once the embryo has grown to its full-grown state called a blastocyst stage, that's when it's eligible to get a tiny biopsy and get frozen immediately. And about a week later,
Wow.
I call the parents and I tell them the first embryo is genetically healthy, and we also know the genders. The second one has Down syndrome. You
you can tell that early on.
Yeah, you can tell by the chromosomal analysis that we do on the embryo if it's genetically
Wow.
chromosomally normal or if it's abnormal.
Wow. And wait, is this a lie? This is another lie coming for you.
I'm ready
Is
for it.
sperm only 1% sperm? Not that this is your field that you get
So-
into, but I've heard this, and I want to just clarify for all the women.
So
who
what
are
is the
thinking about
definition
it.
of what you're calling sperm? Are you talking about the ejaculate?
Yes.
at the time of orgasm.
So when you ejaculate, it's only 1% sperm. What's the rest?
Probably even less.
Oh,
So
wow.
yes. So when a man ejaculates,
Yeah.
and the fluid that comes out of the penis
Yeah.
is called the ejaculate, the majority of it is prostatic fluids. Fluid
Wow.
that comes from the prostate that swim and carries the sperm. The sperm that's in it is microscopic and probably not even 1% of what's coming out of your body.
Wow. Yeah. And I think that's like a subject matter that we never talk about, right? It's always women's infertility. But there's been a lot more research now on men's sperm and the quality of their sperm. And
So there's a lot of research now that has shown that general fertility and infertility issues are caused 40% by women, 40% by men, and 20% reasons unexplained and we haven't figured out yet.
that's wild. Those numbers are wild, right?
Yes.
Because it was like, it's on her. She's too old. Now we know it's
It
a little
used
bit
to
of
be,
both.
but it's not.
Yeah.
It's not. And actually, in the last decade, it's been shown that sperm quality, like around the world, has been dropping.
I believe that.
These are really good hand holders.
Yeah, I
mean,
believe.
it's just
I like that you have your hands
I've never
displayed.
been in such a good chair that you just have a place to put your hands.
You have to get a fresh manicure just to get into these chairs. Like really good. Well, I mean, I feel like times are changing. Obviously, women are having kids later, and men. We're understanding that it's not all on women. Also, there's different types of ways to get pregnant now, and different couples. And what do you see the most? What is the problem that you see the most coming through?
So I think what's the number one problem coming through is that people just can't get pregnant for their first kid, and they come to see us. Usually, like I said, it's usually age of the female that's the problem.
Yeah.
But more and more we see that it's a sperm problem. And then the other biggest population of patients that we have are women that are really being smart and proactive to freeze their eggs. But one area that's growing drastically, has always grown and grown and grown in my practice, has been our same-sex couples. So our lesbian couples and gay couples are doing amazing, and single people that don't really need someone, whether gay or heterosexual. They are coming in all the time to have kids as well. People can do this alone. A lot of people do.
Yeah. Why do you feel like there's such lack of information out there, or maybe like there's such misinformation out there as far as fertility and women's reproductive organs?
I think that's probably the most important question that's been asked of me right now, and I really don't know what the answer is.
I'm glad I thought of it.
Very good job. And it wasn't on your little cards.
Yeah, no, I haven't even looked at the cards.
Because you're so good.
Thank you.
So I think that it's really sad, but it was a topic that was so ignored and taboo for so many years and generations. It had to do with people's well-beings and their manlyhood and their femaleness, trying to have a kid.
Right.
It's a natural gift that God gives you, and when you're not able to do it or have it or show it, it's a problem.
Right.
So it's taken, I've been now doing this I'm in my 19th year.
Oh, wow.
And
My
it
age.
has changed, exactly.
Yeah.
It has changed significantly.
Yeah.
So from the early days when I started, there were very, very, very few women were talking about their infertility issues at all with anyone else.
Yeah.
Now, it's not a subject that is as taboo, but still, not every woman is running around saying, I'm doing IVF, I'm infertile, I can't get pregnant. It's just something that is just still not one of those topics. It's very, very sensitive. I think because of the fact that it's so sensitive for men, so sensitive for women, so sensitive for couples together, it's not something that's talked about.
Right.
And I think the education that we give younger students is very, very, very poor.
I was going to ask you about this because the more and more I'm trying to research about perimenopause and menopause, there's like a lack of education within the field, just even about the subject matter.
Completely.
Yeah.
So I went to back to school night in my oldest kid's school last year, and she had a class it was about human development.
Yeah.
And I went up to the teacher and I said, if you ever want me to come and talk, just let me know.
Yeah.
And I thought he had completely forgotten. And 3 weeks before school's out, I got an email saying, we're ready for that talk.
Yeah.
So I went into a class. My daughter was in the class. I feel bad that it made her feel uncomfortable, but she's
so embarrassed,
heard so much about this around that she didn't really. And we started to talk about everything. And I just remember saying a word, I think it was maybe masturbation or ejaculation.
And everyone's laughing.
And then one of the boys just started couldn't control and just started laughing. And I said, it used to be really funny to talk, hear these words from me too. But I don't want you to think it's funny. I want you to learn what it is so you're knowledgeable and smart about it. And afterwards, I got a call from the teacher and said that 1 hour taught these kids more than anyone else in the school
The
has
entire
taught them about
semester.
anything.
Yeah. I think just making it less a weird topic. I mean, I'm in line and I'm like, are you on hormones? I'm very open, and I think women should be talking about it more. I do stand up the other day. I said, is anybody going through perimenopause? And I see a room full of women in their 40s, 50s, not a single woo. I think there's a lack of education, but also just a lack of there's some discomfort around it.
There is.
You get older.
It's going to take a minute. It's going to take a minute. And it took a minute before we get to this place that I'm going to freeze my eggs. Oh,
Right.
I froze my egg. Now it's not a silent, horrible things. Oh my God, you froze your eggs. It's like, wow, she's smart. She's industrious. She
got her
has
money together?
insurance, or
Yeah.
she has money, or she had the brains to get it, and she did it. And now she can, become that career woman that she wants to be and get everything.
I love it. You can have it all.
You can, but you got to be smart.
You've got to plan ahead.
You got to be resourceful.
Yeah.
So it was an article it was in an interview I was in, and they were talking about the fact that when you're young and don't have a lot of money, it's really hard to prepare for this.
Of course,
But just like
yeah.
you prepare to go out on the weekend, maybe you should prepare to put $100 away a month.
Right, if you really want a kid.
Right.
And it's also the
Or it's
responsible thing if you want a kid to
if you
sort
want
of
to be able to
plan.
freeze your
Yeah.
eggs by the time you're in your late 20s.
Right. And also people change their minds so much more now, right?
Well, this is something that I've heard
Yeah.
so much. Women and they're 39 years old and they're like, I never thought I wanted to have kids, and something in me changed this year, and I just think there's a chance I may want to, and I don't want to regret that.
Right. And then you're like, too late, too bad. You're 39, you're done.
No, that's not
Get
what
your
we say
coffin
at all.
together.
That's not what we say at all. We say absolutely, you're smart, we're going to
Try,
help
yeah.
you, and we're going to help you the whole way through.
And can I ask you, what would you say a percentage, this is going to be a loose number, obviously, but of the women who freeze their eggs, what is the percentage of women who go through the egg retrieval out of those?
So from the people that I initially see, what percentage of people follow
through all the
and
way.
actually do it?
Yeah.
It's a really good question. And whenever we followed up, sadly, the number one reason that they didn't follow up
Yeah.
was financial.
Yeah.
So that's really one of the saddest things. I don't want to toot my horn, but
Yeah.
my number is pretty high.
Cool.
I get people that come in all the time. They're like, oh, I went to somewhere else, but now, my friend came to you and,
Yeah.
and I complete it. So I don't know exact percentage, but it's rather high.
Are there funds that women can reach out to?
Yes.
Where they help
Yes,
them?
there are.
Yeah.
There are. The Jewish Free Loan Association.
Oh, wow.
Which does not only give loans to Jewish
Yeah.
individuals.
Okay.
It gives interest-free loans
Oh.
to individuals that have infertility issues.
Wow.
But there are a lot of employers these days, and I tell all women, if you're looking for a job, make sure you look and see what kind of coverage you have in terms of fertility and egg freezing, because many patients have told me, I took this job because it had fertility benefits, and the other job did not. So
Right.
I want to just a shout out to the Netflix and to the Snapchats and to
all
the
right.
Google and
Yeah.
to all of the big Disney. Sorry, I forgot about
Yeah.
that. All of the big providers that are
Yeah.
giving amazing health coverage.
Yeah, not only that, but I mean, there's maternity leave also that people still don't get. And now in more corporate settings, we've been seeing, menopause stuff with menopause and working from home and maybe having some extra care around certain times of the month. And I think that's pretty interesting. I mean,
I
we
like
used
the
to be like,
self-advocation right now.
well, I'm
I
just
love
into it because I mean, in my field, there's no HR. I'm in comedy. You know what I mean? If I don't get my butt squeezed one night, I'm like, it was a good night. But I just feel like there's not a lot of sensitivity around, there's tampon commercials where it's like a girl in a karate class. It's like, no, you should be resting. We're promoting women and we're more gentle towards women now more than ever.
It's very interesting that you just said that because I go to China to see patients all the time.
Wow.
And we've had a lot
Yeah.
of Chinese individuals come to our clinic in the US. Tomorrow I'm leaving. It's going to be my 14th trip there.
Wow.
I didn't know that after you deliver, every single Chinese woman after they deliver goes to a special hospital, like a hotel hospital, where they have midwives and baby nurses that help you for 40 days. And in medicine, there is a word for the 40 days, the 6 weeks
Yeah.
after you deliver.
Yeah.
And I remember when my grandmother would say, when she had a kid, she just laid in bed and her mother-in-law would bring her the kid, feed her, and then take the kid away and then just
Yeah.
bring her food. And I thought that was weird. But it's something that has been known, and in our world, it's not.
Yeah.
And in the US, they want you to be back and skinny a week later at work.
Exactly. Right.
And not worry about, and then they wonder why you can't produce breast milk.
Right. And then women are so stressed out, they all have postpartum, you know,
Yes,
and
exactly. I think this idea is incredible. This postpartum, hospitals and care that they give to women all over their entire country. I think it's incredible. And everyone who's ever done it has said it's unbelievable.
But is it sort of a systemic problem? Like America wants to keep you sick because you have to pay for insurance. And then is it too much of a system?
That'll be our next podcast.
Different podcast, different times. So women planning, they should start planning ahead. That's the plan. If they're later in their lifetime, test their hormones, see if they're still eligible for egg freezing. And then my other question is, when you keep your eggs frozen, how much does it cost to keep them in their little frozen egg hotel?
So, I think all clinics have different prices, but I know that it's as much as like from a couple $100.
A month?
No, a year.
Oh, a year. Okay.
Yeah, a year.
Okay.
Yeah.
LA prices for rent.
You never know. Next year, maybe double.
Right. Yeah.
If the world continues the way it is.
Right. It's cheaper, but your eggs
Yes.
hotel. And do you have, so after a woman does the egg freezing the first time, have you seen patients come back and try it for like a different egg within that batch often, or?
So I'm going to answer the question the way I want to.
Okay, perfect. Do it.
Not the way you wanted me to, but the way I want to.
Hey, I'm not leading you up to anything. These one-liners were coming out of your
So I think
mouth.
that I have had women freeze their eggs more than one batch.
That's what I'm asking. Yes.
Yes, I thought that's what you were asking.
Yeah.
So I've had women, I had one woman freeze her eggs 5 times.
Okay.
Yeah.
Loaded.
I have to tell you.
Do you have her number or?
Well, I think that she has really good insurance.
Okay.
But
yeah, I'd like to meet her.
Yes. That's amazing.
Yeah.
I don't think most women have it in them, but almost, I want to say the majority of women these days are freezing their eggs more than one cycle.
Wow.
Yeah. Because I think they've realized that just freezing it just one cycle is not good enough. And it's not going to give them enough eggs and as a cushion and as a backup plan. And many people are using these eggs.
Right. If you want a child as much as you want
and to answer the question that may have been coming out as well, like when you come to thaw your eggs, you can say, okay, let's say I have 20 eggs and you can thaw all 20 of them if that's Mr. Right and you're never going to meet someone else.
Yeah.
Or you could, thaw 5 of them, 10 of them. You can choose how many of them to thaw.
It's not ground beef. You can put it back in.
Yeah.
What about, sorry. Obviously, your eggs are not ground beef. You guys get what I'm saying. When you're going through the process, I wanted to ask, because I think for me, like initially when I wanted to have kids and go through the process, I was very scared of the hormone intake and like what that would do for me emotionally.
I really appreciate you bringing that up because it's one of the biggest myths is that we're injecting you with hormones. Like we're just injecting progesterone and estrogen into your body.
Which now I want it.
And we're not.
Yeah. Right.
So we're giving your body these precursors, and then your body makes its own hormone. So when your estrogen starts to go up into the hundreds and eventually past the 1,000, it's your own body's estrogen level that's going up, not estrogen that we're injecting in you.
I knew it. I knew it. But you do feel a little extra off? Obviously, your emotions are going to be a little bit in a range.
I've seen all different levels on the spectrum. I have seen people that have been miserable, cried every single time they came in, and made it a very difficult, challenging process for them.
Right.
But I don't blame them because if you took your life savings and now you're finally like 43 and your boyfriend left you after 10 years of being with you, I'd be crying every single day during the process as well.
Look at that.
However, if you're doing this for all the right reasons, I don't think there are reasons. Like there are people that it felt great. There are people, the majority of my patients, 98%, say to me afterwards, this was not nearly as bad as I thought it would be, and I did great. And I felt okay, other than being a little bloated and a little crampy after the procedure.
Right. And you don't think there's not going to be like an emotional shift just because of the hormones?
When estrogen levels drop, and they drop kind of rapidly after the procedure, some people do feel emotional, and I think that is kind of linked with the estrogen level drop.
Okay. Interesting. So do you feel like, can you generalize that or not really? Like when you have high progesterone, you feel this way, or is there a way to tell in that way?
Not necessarily.
Okay.
Not necessarily. And again, every single person that goes through this feels a little different. I think sometimes it's really hard because after like the 5th or 6th day when your ovary starts to grow, we tell people not to exercise or have intercourse.
Okay.
So that can be, that causes people a little sometimes more discomfort and stress that they can't exercise and they can't, like burn and get over the stress of what they're doing like that.
Mm-hmm. Yeah, I see. So it doesn't come, it's maybe like a factor, but it has nothing to do with the direct injection of the hormones.
Yes.
And I know hormone therapy and all that stuff is not exactly what you do, but can we talk a little bit about that?
Absolutely.
Just because I'm kind of going through it. So I'm going through an early perimenopause. Why have we not talked about perimenopause?
Why don't we explain what perimenopause is?
Please.
So the perimenopause is the duration of time when you're absolutely fertile and between that stage and being menopausal. So it's called the perimenopause. It's a time around menopause.
It's like menopause, but cuter and younger.
It's cuter and younger, and
Yeah.
it usually begins for patients after the age of, like, let's say 40 to 50.
Yeah, I like to say perimenopause is the gateway drug to men not noticing you. um, so you are in perimenopause. They say it can be range from 4 to 12 years. Am I correct in that?
Correct, yes.
And the average age of menopause being 51?
Correct,
51. Okay. So women as early as 38, 39 could be going through this process. Because a lot of people go, oh, how do you know you're experiencing that? I'm like, if you're that age, you most likely are experiencing that.
I think that under the age of 40, having those symptoms is early.
Okay.
If you are getting, menopausal symptoms under the age of 41, it's actually called premature ovarian failure.
Yep. Mm-hmm.
So, or now they call it premature ovarian dysfunction.
Right.
Okay, so maybe not complete failure.
Which women can have also even in their early 30s.
You can.
Right,
I mean,
right.
We've had patients that went into early menopause in their 30s. I mean, early
Wow.
30s.
Is there
And even in their 20s.
Wow, is there something that is correlated to that, or is it just like a random kind of you win the lottery?
I mean, a lot of that is genetic.
Yeah.
A lot of them they're also forced into it for like chemo or radiation where they have no
Right.
control. There are some patients that it gets complicated, but like you could be a premutation carrier or Fragile X, and those patients generally can go through menopause a little earlier and have difficulties getting pregnant, but I don't want to.
So there's like a lot of things that are linked to early menopause or perimenopause, but why don't we know, like why, growing up, I never had an idea that even existed. Like, why is there such a lack of education in that subject matter?
It's interesting that you say this. I remember my grandmother's sister and my aunt, who was like
Yeah.
probably at that time, like, her late 40s.
Yeah.
She's like, there's some pills you take and it makes you feel great. And I just didn't know what in the world she was talking about. I was like 9 years old.
Yeah.
Well, of course I went into that field.
Right.
But there are supplements.
She's talking about ecstasy the whole time.
Yeah, it was all
It's not
ecstasy.
even-
Yeah, it was,
yeah.
It was estrogen
Yeah.
and ecstasy.
Yeah.
So, there are people don't understand the word is so scary.
It is.
Hormone replacement therapy. But a
is.
hormone replacement therapy, that pill that you take, is about 1/10 the amount of hormone in a birth control pill.
Wow. Okay.
Yes.
So it's very low.
So it's very, very, very low. And if that level of estrogen and progesterone kind of get your body back to normal
Yeah.
and allow you to sleep and concentrate and not get hot flashes and be as normal as you can be and not feel dry vaginally,
Yeah.
all of those things, why not?
That's a very scary thing.
It's a very scary thing.
It is, like,
And
'cause I'm a
I
lot.
wish,
Yeah.
just like there's a fellowship program for fertility and there is for oncology and GYN and there is one for like high risk obstetrics, I wish that there would be a fellowship program just for hormone management and
100%.
menopausal care, because
Yeah.
I think it's an area in the field of OBGYN that is really lacking.
Yeah, thank you for saying that, because I've been just frenetically looking for any kind of information. I have my doctor's number. I'm texting her way too much. And I think it's you're going to get different opinions too, which is difficult.
Every single doctor has a different opinion. We're very opinionated, and
Yeah.
there's many different rights, and there's made many different rights from different doctors, and not all those rights and the avenues that are going to be recommended to you are going to be the right one for you. And that's
Yeah.
why I'm a very, very firm believer that I tell people that ask me all the time, when they ask me for a referral, I'm like, why don't you let me get to know you a little bit better? So I
Right.
can tell you what kind of doctor I think would be good for you.
Specifically,
Like some
yeah.
of my doctor friends are bookworms and explain things scientifically. That may
Yeah.
be perfect for someone that likes that. Some people need someone who is not going to be an alarmist and needs to relax them because every single thing is worrying them.
Yeah.
So finding the right doctor, we could do this an entire episode,
Please.
is such an incredibly important thing. And we're in America. In
Yeah.
big cities like LA where we are, there's a million doctors.
It's so hard to find a doctor. I think a lot of women get overwhelmed and they sort of stop the process, and then it's costs.
That'll be my
That's-
next
yeah.
business, trying to find
You
people the
should.
right doctor for them.
People hate going to the OBGYN because I understand this. But
Meanwhile, you haven't even used those.
I have,
like
I know, I've been
90%
sitting
of
chill.
they spend
Well,
so
sitting
much
this for a
money on
long
these
time.
chairs.
I mean, I'm stretched, but I should have done some hip opening exercises. I remember my doctor came in and she was like very specific with like, this is your discharge and this is how your discharge should look. And I had never had a doctor that was so open in
That's
the way
great.
she spoke. So
That's
for me,
great.
that, obviously for me, that was better. But I think a lot of women are nervous when they're in there and they don't end up being very honest. They're nervous about like, oh my God, my bush looks this way. Like, can you please soothe women and go, I've seen it all. You should be calm in my room.
I mean, people make those comments to me all the time. But
Yeah.
not with those words, but
Right. And nobody says bush in your office.
Not heard that one yet in the office.
Okay.
But as
Yeah.
as a professional doing this, none of those things faze me in any way whatsoever.
Oh yeah, because by the way, nowadays my TikTok is just like all hormone talk, and it's all these people going like, "Can you not sleep? Do you have fatigue? You got to get your cortisol levels low." So like, can you explain a little bit about the endocrine system and things you should be doing?
I think that the endocrine system is, like I said earlier, is one of the most complicated systems of our body.
Yeah.
But for us to feel good and to look good and to just be happy, it all has to work well.
Yeah.
The endocrine system, the neural system, they are complicated. But there's a lot of things that people can do to make their endocrine system and their hormones optimized. And that's what I love, because there are companies out there that have dedicated themselves to try to make people feel better. And you have to find one that you trust, and you have to find one that knows what they're doing. So I, for example, myself, I take a supplement in the mornings called ashwagandha. And ashwagandha, the more and more I did research on it, has so many different benefits about increasing, your happy mood.
Right.
It also decreases cortisol levels. I always wondered, how am I feeling? Because after a few years of taking it, I noticed if I didn't take it, that there was a slight difference.
Yeah.
And at
sometimes
first I was
feel
like, is it in my head? Is it just like a placebo? But then I really it's been long enough that I can notice a slight difference when I don't take it. So I actually started to do a little research on it, and it brings down, for example, cortisol levels. Cortisol is the stress hormone, and it's like
We hate her.
The worst.
We hate her. Yeah.
It's something that we don't want high, and it causes a lot of issues. And in this day and age, I think people's cortisol levels are probably at a sink.
We're on our phones all
And
day.
It's you know
Yeah.
what? Yes.
Yeah.
Being on social media can induce like spikes in your cortisol.
Right, yeah.
So I think it's important. That's one very, very important hormone.
Yeah.
We've talked so much about estrogen and progesterone. I think for women, they are incredibly important hormones to make sure that they're balanced and they are being, controlled in the right times of the month and the right levels that they're supposed to be. These are all things that I think are really important. I think, for example, our thyroid is an incredibly, incredibly important gland that has functions that if the thyroid is off by just a little, our entire system is off.
So that's something you can also get tested in your blood.
Very
correct?
easily.
Okay.
So your thyroid can be tested with a thyroid stimulating hormone or a TSH level, and that's the basic thyroid test. But there's a couple more with T3 and T4, and there's smaller different.
T3.
That
There
was the
it
T3 you were talking
is.
about.
Yeah.
So T3 has to do with your thyroid as
Okay.
well. And thyroid needs to be optimized for pregnancy. It needs to be optimized for just feeling good and just in general to do well.
And it has to do with like a lot of weight loss, right? Women can tell often if they have like a hyper or.
So if your
slow-
thyroid is working slowly, and it's
Yeah.
called hypothyroidism,
Yeah.
your metabolism
Kind of
isn't
rude
going to be
of a name.
Yeah.
A little rude.
A little bit. But I didn't make it. So in case,
All
just
the
don't hold it
names are
against
rude.
me.
Yeah,
Just
yeah.
don't hold it against me, Jade, please.
Yeah, I promise.
So hypothyroidism,
Yeah.
if your metabolism, if it is really significantly out of control, your metabolism will slow down, and everything you eat, you start gaining weight.
The best. Love that.
Yeah.
And then hyper is if your
So
metabolism
hyper,
is too high.
when
Yeah.
it's going really fast, your metabolism is really fast, then you can't even like gain anything. You keep losing weight and you don't even know why, and you're eating.
And does that have some like connection with anemia and iron deficiencies, or is that a whole other ball game?
No, that's a whole other ballgame.
Okay.
So, but iron affects your anemic levels and your anemia. There's different things that iron is good for, but all of these hormones together, I think, are incredibly important to make sure that you have them balanced. And I can't just stress enough. Every single patient I ask, maybe 5% have a general doctor they go to yearly for a physical exam. And that, for me as a physician, is crazy.
Yeah.
Everyone should be going at least once a year for a checkup. Check your hormones, check what's important in your age category, check what's important if you're male or female.
Can we do a little checklist beside this too, so people can have it? Yeah.
We can do that.
Yeah.
So these are really important things, and that's why I think having a great primary care physician is extremely important.
Which is so difficult to even have now. Like, you'll call a doctor and they're like, yeah, we'll be able to see you March next year. Like, oh, shoot. There's definitely a shortage of doctors and too many influencers nowadays. It's kind of mismatched.
Well, you can probably make more money being an influencer than a doctor.
At
so
this
I think
point,
maybe that has something to do with it.
Yeah. Well, if they want to freeze their eggs, they have to make money. So keeping your cortisol levels low, ashwagandha is something you recommend. And is ashwagandha, does it come from mushrooms?
You know, I'm not sure exactly what plant it
Yeah.
comes from. I'm not
I feel
sure.
like it's a mushroom thing.
I'm not
Yeah.
sure if it's a mushroom.
Yeah. Ashwagandha is a good thing. Just other yoga, anything that can kind of keep your stress levels
Well, I think
down.
anything in general that can bring your cortisol levels down, like meditation, sleep.
What's that?
Exactly. I'm glad that people are pushing for sleep, though, because there's so much data behind sleep and the
Yeah.
benefits of sleep. And I think for such a long time, it was completely neglected. And, now we have all the apps on our phone that tell us about
Well,
sleep.
it goes back to the whole bullshit of America, right? Like work,
Exactly,
never
exactly.
sleep,
And
never
for
take care
what?
of yourself.
For what?
For what?
Yeah. I was saying
Yeah.
earlier when we were away this summer, like, I saw everyone from all different kinds of socioeconomic backgrounds on vacation.
Yeah.
The sad thing is, if you're in America and you're not, at a higher socioeconomic level, forget your vacation.
Oh, what
you're not
vacation?
going anywhere.
Yeah,
you have
you're
to work
working all
the
day.
whole year.
Yeah. For like a very average, just survival kind of a life.
And in Europe, it's completely different. Even if you're living an average life or have an average job, you take your 1 month
Life
of
enjoyment.
vacation. Exactly.
Yeah. And then your life is longer.
Right.
But
And you have
we
something
never
to
know
look-
that.
And
yeah.
you have something to look forward to.
Lack of sleep was actually kind of how I came to this perimenopause thing. I just would wake up in the middle of the night with my heart racing. And I mean, if I could even fall asleep at the time. And over time that started to really like get to me. It started to get kind of like exhausting, and that's why I did it. So what are some things for women to look for? Some like obvious signs, and we can close out on this. Some obvious signs that you might be, your hormones might be.
So I think
leaving you.
I feel like hot flashes is one of the first signals that someone will feel. That's like when you get extremely hot and sweaty, out of control for no reason whatsoever. I think a lack of sleep, a lack of concentration, vaginal
Brain fog.
dryness. These are probably the most typical symptoms that someone is going to feel when
Yeah.
they're hitting the perimenopause.
Those are good.
And
Yeah.
also, if your periods become irregular.
Okay. So just everything we all go through anyway. So that's the hard part of it all.
Yes.
Do you have any kind of horror stories that you can share with us, or
I'm not
do you?
going to end this on a horror story. I have a lot of beautiful stories.
Okay, yeah. Tell us your most beautiful little short story.
I have a million beautiful stories.
Pick
I think,
one.
I just think the fact that I am able to help families grow and have kids when it wasn't an option for people has been one of the most rewarding. And that story never gets old for me. Day after day after day, when I see a heartbeat on an ultrasound of a new pregnancy, that excitement that I feel, it gives me a hot flash.
I was going to make an ending joke about you looking at my vagina and telling them it's good, but I feel like I can't now because it's so beautiful. Thank you so much for coming out and educating us and helping. I think little by little, we're all going to become more educated, and the next generation can have more tools than we had.
You and I are going to educate everyone.
Yeah,
We're
let's
gonna
do
this.
it.
We are doing this.
Thank you so much for coming
My
by.
absolute pleasure.
And
Thank
getting
you
in
so
the
much for having
stirrups.
me. Thank you.
We started up. You
I
guys,
know,
one more
we
time.
did.
Yeah.